as well as education issues and the achievement gap. And that was the conversation that we had. I think Dr. Lusso did an excellent transition into not only the problem, but also starting to understand some of the solutions to the problem. And I think our next two panels are really going to start to drive in and help us hone in on what are actual interventions and solutions that we, as educators, we as practitioners, can start to implement in order to make the changes that we so desperately need. So with that, I would like to introduce Cheryl Rader Brown. She is an associate professor of early childhood education at Wheelock College, where she has taught in the graduate program over the past 24 years. She also teaches in their graduate early childhood degree programs in Maine, New Hampshire, Bermuda, Singapore, Taiwan, and Barbados. I'd like to travel with you at some point. Those places sound awesome. In keeping with the theme, I asked Ms. Brown about her most influential teacher, and she said Miss Ann Romick, who was a third grade teacher. And not only was she a family friend, but she focused on every child in the classroom and made sure that they had a chance to learn and ensure that each child learned everything they were supposed to in the third grade. So with that, I will turn it over to Ms. Brown.
Thank you. I think we're going to use a little bit of a different format this afternoon. We have 4 panelists instead of the morning panel where we had 3. And I want to make the most of our time for all of the expertise that we have up here. So I'm not going to do long introductions. There are bios in your programs that you can look at. But we have an exciting panel here. I think it's an exciting morning. I co-chair a governing board of a pilot school in Boston Public Schools that has K0, K1, K2, and first grade. And their focused goal over the last year and a half has been on instructional language, this academic language. And they've really, a long-term great model for families, surround care morning and afternoon. Families really love it, and they've been at it for a long time and maintain their staff over a long period of time. But they have found this particular instructional goal that BPS has asked them to identify and work on really, really hard. What does this instructional and academic language look like in a 3-year-old classroom or a 4-year-old classroom? Or traditional kindergarten. I agree also with the question that you raised earlier, Samia, about access. There's a long waiting list in many of these places. But we're going to move on to this panel here that has to do with early childhood education and intervention. And we have 4 very interesting speakers here on the panel for you. That include Colin Rose, who is the Assistant Superintendent for Opportunity and Achievement Gap in the Boston Public Schools. We have Turahn Dorsey, who is the Chief of Education out of the Mayor's Office, and also the co-founder of the Boston Basics campaign that I think you will find very fascinating because it's looking at working with families and lots of partners on many of these kinds of things that we feel like have to be community-wide and have to be addressed in a much more comprehensive way, as we heard from Dr. Lusso and others this morning. We have Meema Luisi, who fortunately on this panel, I'm reconnecting with her. She was my former graduate student and has been a pre-kindergarten teacher for the last 8-9 years, and is working on an initiative where people are teaching, really working. She's part of an initiative where people are looking at what do teachers need to do specifically to support children who've experienced trauma or who are experiencing ongoing trauma, a very interesting initiative. And last but not least, my colleague at Wheelock, Lenette Azzi-Lessing, who just published a book called Behind from the Start. There's also more of a title there, but I think she's had a long history in looking at childhood mental health and working in systems with children and families over time and looking at all of those issues. So without further ado, I'm going to have you begin.
Good afternoon, everyone.
We're going to take questions for the whole panel at the end.
All right. Good afternoon, everyone. How's everyone doing?
Great.
How is everyone doing? Good. Good to be with you this afternoon. I'm going to do a couple of things. One, just give you some context for what we're working on in the city in terms of early learning, and then do a deeper dive on a citywide campaign called the Boston Basics. Just by way of background, my role as chief of education in the city is a mayor's office-based role. What I like to tell people is that the CEO of Boston Public Schools is Tommy Chang, our superintendent. My role is to be a partner for him, but also to think about learning strategy all the way from cradle through career. All of those spaces that school doesn't cover and all of those spaces that need to be activated, whether it's school-based or community-based. And so a lot of the work that I do is about developing strategies to ensure high-quality learning is accessible wherever it happens in the city, making sure that we're pushing innovations in learning, modernizing learning in some ways that meet contemporary needs of students and families, and I think give that relevant cognitive press and significant challenge that we know learners need and want to great degree. We're also trying to network the learning ecosystem. Boston is a place that features probably among the highest quality youth-serving nonprofits in America, cultural institutions, our colleges and universities. And so we really think that there is more of a systems framework to be introduced to the ecosystem to make learning more accessible. Before I begin, I want to make a couple of observations about the early learning field that we're basing our work on. These may ring true to you, and you may say, that guy doesn't know what he's talking about, and we can talk about that when you come to the mic and ask questions. But I think these are grounding for us and will preface a lot of the things that I have to say, both about our policy work and the Boston Basics. First observation is that much of what we know we need to do, particularly from a brain science standpoint and a pre-K standpoint, is in the literature. We still have a lot of debates about what quality looks like in early learning, when in fact, a lot of the literature, provides us with the elements of quality, but what we've got to figure out is how do you invest in quality at scale and do it consistently across settings. The will is growing from a political standpoint, but given what we know about the power of early learning, the political will is not nearly as great as it should be. In a place like Massachusetts, we're still fighting for full-day kindergarten on an annual basis in the state budget, so it's hard to have a conversation about universal pre-K in the state of Massachusetts, even though there is growing will for it. Roughly 40 states invest in pre-K, but only 9 are really guaranteeing access to pre-K for more than half of their 4-year-olds, and only 3 can really boast to have universal pre-K, Oklahoma, Florida, and Georgia among them. And Oklahoma made a mistake and happened into universal pre-K, and there's a fascinating NPR story about how it was the thing that they were not programming for that they actually wound up doing. So very, very interesting. But I think that there is still, for a number of our decision makers, unfortunately, some level of political capital that still has to be expended to convince people that early learning investments are the right investments to make. And so we've still got a ways to go. Secondly, there are different impact and sustainability challenges across the 0 to 8 spectrum, and I would argue that when you think about 0 to 3, it's as much an economic development challenge as it is a program quality challenge. In the 0 to 3 area, early care, we're often talking about fragile business models. We're talking about low-wage work affecting mostly women of color. And so there are huge equity issues in the business models there, but we also know that there are quality program disparities as well that we have to address. In the pre-K segment, beginning with 4-year-olds, we see fragmented quality across settings. It's probably not as intersectional as it needs to be. All learning, early learning work also dovetails with pediatric work, also dovetails with family services work and a number of other things. So we aren't seeing the intersectionality between systems at the 0 to 3 or the pre-K level. Elementary is still another beast and is much more in the K-12 reform space in some ways. I wish, I don't think Noni is still here, but Noni Lasso has done great work with the Director of Early Learning in Boston, Jason Sachs, around one, getting to pre-K and kindergarten quality and thinking about how we have to scaffold quality now up the grade scale through grade 3. And Noni could talk at a lot more depth about what that work looks like, but I'm proud to say that we're embarking on that work. It's still hard to convince a number of decision makers that that needs to be a deep investment point, because there are some trade-offs on the other end where we're thinking about how do we get our high school students ready to get out of the door. When we see the middle grades lag, what's the investment that we're trying to make to do deep remediation and some other things? And it's really a very disconnected conversation, and a conversation I think obscures our vision around whether we invest in the things that we know work and where we take risks. It has to be a both and, but I think we're often deterred from investments in some of the things that we know work really well and have great potential for power. So there are a lot of things that we have to consider to think about. How do we create a more holistic and seamless system and seamless concept about early learning from birth to elementary school? Third, there's not sufficient systems infrastructure in a space that is so fragmented. Again, we're talking about not just early learning and early care, pediatrics, healthcare, public health, human services. We have to figure out some ways to provide more of a system structure that connects those systems in intersectional ways if we are going to achieve many of the early child outcomes that we want, but also provide many of the two-generation supports that we know are necessary for children's success. So given all of these challenges, our work in Boston has really been focused on improving early learning quality, creating some segment seamlessness from 0 to 8, and integration and systems intersectionality. Two things I'll mention real quickly. The mayor announced Boston's universal pre-K effort in January of this year, and so we are looking to do a large-scale investment in quality in a mixed delivery system. So that is making sure that there is quality behind the school door as well as community-based provider doors as well. There is no way in Boston that we can bridge quality pre-K gaps without investing in both. We can't build enough school classrooms, and we can't expand enough community-based organizations to do it. It's got to be a both and. We know that there's not really an access problem per se, but certainly a quality problem in Boston. We think that about 90% of our children are accessing some form of pre-K, but there are quality disparities there and things that we know that we can address. We also have convened a 0 to 8 collective impact table to think through some of the systems work and intersectionality. 70 organizations at the table and growing in Boston to really think about how to create something that looks more like an early learning and early development system in Boston. So this brings me very quickly to the Boston basics, because not all of our work is systems change work. Some of this is about community capacity building and culture change work as well. And so the Boston Basics is a community-conceived initiative where we had the Black Philanthropy Fund at the bottom, a group of African-American residents who said, we want to figure out how to give back in our communities in Boston. What's the way to do that? So they started convening learning sessions for themselves. They brought in leadership from the state, brought in leadership from the city, researchers, philanthropists, and a number of people. One of the people who walked through the door was Dr. Ron Ferguson at the Harvard Achievement Gap Initiative. And Dr. Ferguson started talking about, first, the importance of early learning, but where you could start to see important skill gaps by race and gender as early as ages 1 and 2. This was compelling in a number of ways and something that this group wanted to act on. But what Dr. Ferguson also said is that there is something that we can do about it. So he's done quite a bit of research. Let's see. I'll get up.
You might have to stay.
Yeah. He's done quite a bit of research and meta-research to help to synthesize a set of messages that have been peer-reviewed and reviewed with parents, educators, and a number of other folks. And I just wanted to show this for pictographic purposes. This can all be found at bostonbasics.org. Maximize love, manage stress. We know we can't lead no stress lives, but that stress affects our children. So what's the work that parents do to make sure that they're cognizant of stress and how it impacts children? Talk, sing, and point. So that we are getting children to understand that the words that they say connect to objects, and the singing is also about connecting to them in a way that is engaging. Count, group, and compare. Early numeracy, and helping young people to understand, or children to understand, that 3 is not just the word that follows 2 and comes before 4, but that it's 3 of something. There is a concept there. Explore through movement and play. So we're starting to build spatial awareness and coordination and a sense of the world. Read and discuss stories. I think, to Noni's point, not just making sure that we have the vocabulary, but that there is a comprehension that's building, and we're also switching the paradigm on speech. Who's leading the conversation? If the child is talking about the book, it doesn't necessarily even have to be the story, but if they're pointing at the picture, making their own story, telling you what's going on, it starts to shift the locus of the conversation and who is leading. And so these are really 5 principles that we want every caregiver in Boston to understand and activate. So we're trying to get to mom, dad, grandmom, neighbor, aunt, uncle, whomever it is. This is what we want adults across the city to understand and to know, that there is something that they can do with young children to start to build their cognitive skills. So we've built an open source toolbox around these concepts. The website has a lot of the content that I've already talked about, and a lot of the content that you'll see here. One of the main features are a set of videos on the website where we give you an overview of each of the Boston basics, but there are videos connected to each of the 5 basics, with parents kind of telling their stories about their practice, giving tips, helping to understand, how do you activate this principle? This doesn't require you to buy anything else, pull any more materials into your household or your classroom, but really to figure out how, with the resources that you already have, you are practicing these 5 things consistently. Print materials, which are downloadable from the website. We're conducting a series of community trainings for educators, for parents, for anybody who is working with adults supporting children. We're doing train the trainer model, so that we make sure that our team doesn't have to show up everywhere, but we're starting to build a cadre of adults across the city who know what the basics are and are able to activate them. Social marketing pieces are going on. I think last week was the week of the young child, and so now we are starting to feature billboards and a number of messages across the city to remind adults about the basics and about practices. There is an app coming in the fall. It is in beta testing right now, through which we will be able to do, on a weekly basis over 3 years, a push to parents to remind them and to give them a few prompts to practice. We will also be asking for information in return. What are your habits of practice? How often are you doing this? It's one way for us to get some feedback. The key here is achieving social ecological saturation. So it's not about creating a new program. It's making sure that many actors in the community have these tools and that they are interfacing with adults, caregivers around these. Our housing developments, childcare settings, community centers, schools and museums. The point is to build a redundancy of the message. It may not necessarily be intensity or depth of exposure at every interaction, but it's about successive exposure over a very long time. And so this is just a quick sampling of the kinds of organizations who are partnered with us. There are about 100 organizations partnered in Boston with the Boston Basics, activating the tools and the messages in different ways. Barbers for Health, Bethel AME Church, where I've now seen 3 sermons about the Boston Basics, in addition to parent training, yes. And we're talking about the adaptability of the messages. Barbers for Health, literally the barbers getting dads in the chair and asking them, what does reading look like at home? What does your numeracy practice look like at home? The Demick Center recently opened up a new reading room where they are featuring the Boston Basics. Mass General has created its own push technology through text to remind new moms and dads about the Boston basics and to continually ask, are you practicing? Are you practicing? There's more to say about this, and I know I'm over my time. We are setting up some evaluative practices, doing a time-interrupted series evaluation. We'll be working with the Boston Public Schools to track some cohorts of young people and their kindergarten readiness over time.
And I think next is Colin Dorsey.
Good afternoon. It's a little bit better than you, Ron.
I primed him.
I'm Dr. Colin Rose. I am the Assistant Superintendent of Opportunity Achievement Gaps for the Boston Public Schools, which sounds like a huge job. It is. I don't go to sleep sometimes at night thinking about all the students that we have that are, to me, have been marginalized, and what we need to do as adults to fix the conditions so we don't continue to marginalize students. One of our main objectives as a district is to close opportunity achievement gaps. So we're really taking it on as a fact that is not on the students or really the community, but some of the things that we've been doing as practitioners and educators or not doing that deepen and continue these gaps. And so kind of in that frame, I wanted to look a little bit around some of the stuff we talked about. In one piece around disproportionality within access to our early childhood programs and BPS, and then the disparative results through fifth grade within our early childhood programming. So starting with disproportionality. So yes, we're trying to build a mixed delivery system with the city. Right now, we're not universal at pre-K. So taking a look who actually gets access to pre-K, and you really dig into the demographics, there are disparities and disproportionality. So when you look at our Hispanic population, in the last 5 years, the Hispanic population that are accessing K0 and K1 has actually gone down 5 or 6%. As their proportions of the school system has rise. So they were at 43% 5 years ago. They're down now to 37% of those students who are accessing K0, K1. Same thing with Black enrollment. Black enrollment as a proportion has gone down over the last 5 years. And really where we're seeing increases is in our white population. And actually, the biggest disproportionality is with our middle class and above population, so our non-low income population, as accessing our K0 and K1 seats at a higher proportion than they are of our district. And those numbers are around 34% enrollment versus 23% of our actual K-5 students. Obviously, we know the research behind early childhood education, and it's problematic when our students who need it the most are the ones that are not getting the access to that deep education we need. So what I do is I put things on Front Street. That's my job. We need to really concentrate and dig into it. So I took my job about a year and a half ago, and one of the first things I looked at it, because I did a lot of my doctoral study on early childhood education and seeing who was actually accessing, because we actually do have, I think, very high quality early childhood programming in the Boston Public Schools. And so having discussion with Dr. Jason Sachs, who is the executive director of early childhood learning, we started having conversations about what can we do to kind of stem this tide, think about putting guardrails on systems so that those who should be getting access to it, who really deeply need that access, are the ones that are actually getting access. And so that has gotten some traction. So some of the strategies we're looking to do moving into next year, one of the problems when you look at especially income, if you have a pre-K program that runs just the span of a school day, right? Especially in neighborhoods, I live in Grove Hall, the Kings down the street from me. The Kings K1, K0 classrooms run from, if the school runs from 8:30 to 3, if I am a working class parent, that is not enough time for me to do all the things that I need to do. I need surround care. So if a school is not being very intentional about some of the barriers that low income families have, then we have, like we do with the King, under enrollment. And so some of the strategies that we're looking at is in those schools, especially in communities that are low income, how do we partner with community organizations to create that surround care? So I just had a discussion yesterday about making true 9-hour school days for early education students in those classrooms. And I think Jason's going to pilot that in 9 schools next year that have been traditionally under-enrolled. Beyond that, when I take a walk around schools, there are some areas in the city where you actually can see not only an access gap, but actually a demographic shift within the school, meaning that quite often you have middle-class white families coming in for K1, K0, and then the rest of the student population does not fit that student population. And so we might be seeing the same kind of phenomenon play out in fully enrolled pre-K classrooms, but still have that access gap where it's still, you know, if I'm a middle-class family, I might be able to pay for before care, I may be able to pay for after care. And even those low-income students within that neighborhood, that model does not fit for them for pre-K up into kindergarten. But of course, you have to go to school. It's mandatory in 1 through whatever. So starting to think about some of those guardrails and some of those barriers to actually getting access for the students that need it. And that's, we are diving deep into what that means and how to figure out an answer to that problem. And so it's not just about quality, it's how do you get the students to that quality? Which brings me to my next and kind of last look at kind of our early childhood system and the way that we run it. It is true that our early childhood program is high quality, but it is not true that our early childhood system closes achievement gaps. So if you look at students who go through our early childhood programs, there is like a 20%, 30% when you look at student standardized test scores in the 5th grade boost versus the same demographic profile, economic profile in the comparison group that didn't go through our K1 programs. But that still does not close the gap between white students, black students, Hispanic students, low-income students who have gone through our K1 programs. So we've been talking as, again, a district around just in general, some of the tier 1 necessities in instruction that we need to see in our schools. And one thing that we're really pushing out of my office is something called culturally and linguistically sustaining practices. So how are we taking the assumptions that we're bringing in as teachers, professionals, building awareness around kind of the construct of race in our society, implicit bias, how those things are internalized by us and our students, and really understanding where is our deep cultural norms, our values, and how are they informed by all those societal issues, so that we can check some of the biases we're bringing into the classroom, truly authentically get to know our students, and then be responsive of the needs of our students versus the box that we've created out of our norms, right? And so that is an initiative that's going across the district, but specifically in early childhood, we've done some work with all the educators, their paras, teachers on this topic. So, for instance, I know a lot of you might know the Dahl test studies that were kind of the foundation to Brown versus Board of Ed. If you don't know, it was a couple of researchers in the 40s who took black and brown dolls, or black dolls and white dolls, put them in front of preschool children and asked for their preferences and why. This has been done multiple times moving up through the years. And last one I saw was actually done by a teenager in New York City public schools who did the same test. It was about 2005. And the reasons you get from students why they're picking what doll, first of all, no matter what race, they're picking the white doll. You ask them why, because they're good. You ask them why you didn't pick the black doll. They're bad. Who looks like you? Well, the black doll, right? And so how are they getting these images? And it's not just strictly school, right? It's society. But what role does school have in rolling back and talking about this and affirming our students' identity? We know the research around self-esteem. We know the research around affirmation and what that does for a student. A recent study done in the fall by Yale actually looked at implicit bias by preschool teacher. where they actually put up a video. They had teachers look at a video of a mixed race classroom, pretty balanced male-female classroom, and told them, I want you to look for problem behaviors, okay? What they did was track the teacher's eyes. Their eyes went straight for the black students, the Hispanic students, and especially the males of color. And they're looking for behaviors. They had them write down some behaviors. Trick was, there were no problem behaviors. Everything that was done in that classroom was developmentally appropriate. And so some of these things are the awareness pieces that we're bringing to teachers in early childhood ed, and we're thinking about across the district so that not only can we talk about high quality in terms of, how are we bringing in reading instruction, but also how are we dealing with the differing populations that are in front of us and what they actually need to succeed, to be psychologically safe, and to be affirmed and to be comfortable in the learning and see themselves in the learning. So it's the pedagogy, it's the materials that we're looking at. There is a initiative across the district that we're calling decolonization of the curriculum, and so obviously that pushes to critical consciousness in the high school ages, but it has implications for the materials that pre-K and kindergarten teachers are bringing into their classroom. We did exercises where we asked teachers to think of materials outside of Jackie Robinson, Malcolm, I wouldn't even push the Malcolm X, Martin Luther King, the 5 regulars that you name me, 5 more people of color that are in your books that you're talking about, and they couldn't, right? And so being very conscious about not only our pedagogy for diversity, but also the materials that we're using with our young children. Obviously, everything else that we talked about, innovation, accelerations, but that's a layer we don't get into. And to kind of wrap up, we had a study done specifically on Black and Latino males a few years, CCE, Annenberg Institute, and Brown University. And what they wanted to come out of that study was not only to look at the gaps, but also come out with some promising practices within the district so that we could leverage that. And I do a lot of work with Roseanne Tung, who's at Annenberg Institute. And one thing that she saw, this was 2015, was actually what they would think of as promising practices she didn't see in the district systematically at any school. And really in the best cases, and what she did was lower her threshold of what she considered promising practices, so she had some schools to study and talk about. At best, our schools were colorblind. They were saying that they're treating all kids the same, which, in the realm of cultural proficiency and in the work that we do is only halfway there, not even halfway there. You got to get to the point where we admit that there are differences, there are different lived experiences, there are different historical differences between the different cultures within our society, and how are we going to create a space in education that takes into account that while also lifting all of our students up. And so I'll stop at that. Yeah.
Thank you, Meema.
Meema Luisi.
Hello. I am a pre-K teacher at Bridge Boston Charter School. It's also in Boston. Colin has said it. K1 is also another term that's used to describe pre-K in public schools and in charter schools. I wrote everything down that I'm planning to say because as a teacher, I have a tendency to really veer off topic to the 5 other things that I'm thinking about right now. But before I go into what I have prepared, there is a short, brief story that I'd like to veer off and tell you, only because it happened yesterday and feels really relevant for the trauma-informed information that I'm going to talk about today. And for me, as an educator, I strive to be very honest with my students. So if I'm going to be out, and I know I'm going to be out, I tell them. So at the end of the day yesterday, I sat everybody down before it was time to move on with their day. Our students stay till 5, and some teachers leave at 3:30, some stay, and told them that I wouldn't be coming in. And about a minute into it, without realizing it, saw 2 students were in hysterics, were crying. And I don't tell you this so that you think I'm an amazing teacher who children really love. I tell you this only because the 2 students in particular who started crying are very steady students. They have experienced some trauma from information that I've gotten from their families, but none of it home-based, much of it community-based, and they don't present as what people expect when you hear of students who've experienced trauma. They aren't aggressive. They don't withdraw. They are engaged. They are active, happy, typical learners. And so I tell you this only because I think it's incredibly important to point out that when I talk about trauma and when other people are starting to talk about trauma-informed practice, that we're not thinking of just students who are either living in poverty or students who are experiencing significant loss or students who are experiencing a variety of other factors. It's also students who are in very steady relationships with the teachers and other children in their classrooms. And these two particular students, my school calls them self-managers because they can regulate and manage themselves quite well, to where I can send them on, roles and responsibilities. If I have to step out, one of them will sit in my chair and the other kids sort of fall in line and respect that. I can't explain it, but it happens. And so telling that story I felt was really important because it, I think, shines a light on the variety of students that experience trauma, and not just what I feel or have heard is what you would assume as the typical student who's experiencing trauma at home or outside of their home or otherwise. So in looking at the impact and at the need, in 2009, the Washington State Family Policy Council conducted research and revealed that between half and 2/3 of all school-age children have experienced trauma. In a lot of this research, you'll hear it called an ACE or an ACEs, which is an adverse childhood experience. And then also in thinking about the need, in a survey of Boston teachers, 91% said that the presence of trauma in their schools and in their classrooms is a consistent, repeated challenge. Mounting evidence has caused educators to take action in addressing the effect that trauma continues to have on students in their classroom. Children who have experienced trauma are weakened in their ability to cope due to a singular negative event or even a series of events. Adverse experiences that can cause trauma are included but not limited to homelessness, witnessing violence, neglect, physical and verbal abuse, divorce, death of a loved one, natural disasters, incarcerated family members, or living with family members who suffer from mental illness or drug abuse. Exposure to these events earlier in the past or even in their present leaves an imprint on their mind, brain, and body, as well as feelings of helplessness, rage, and terror. These experiences can dictate how a child can function in the present and have lasting, ongoing consequences to a child's ability to survive in their future. In classrooms, trauma changes not only how children think and perceive, but affects their very capacity to learn. For a traumatized child, a classroom can be a very unpredictable and threatening place. And for me, at the start of a school year, a lot of that comes out fairly easily because I'm someone they don't know yet. And part of a teacher's responsibility in having and running a trauma-informed classroom is first, as other people have mentioned today, really building those relationships. But moving past the relationship that is just based on, I'm here for you, you can talk to me, but even more along the lines of who are you? And teachers really being ingrained in knowing who their students are and not just there as supports, but there as really almost as community and family members. On the onset of trauma, a child can become hypervigilant, hyper-aroused, have a loss of executive functioning, or live in a constant state of fight, flight, or freeze. When children live in a persistent state of fear, the areas of the brain controlling the fear response become overdeveloped. These parts of the brain may direct behavior even in situations where it would be more appropriate for other parts of the brain. Nancy mentioned this morning the reptilian part of the brain. Students who've experienced trauma very typically will react and live in that particular part of the brain, rather than accessing the higher functioning areas in the other parts of their brain. In short, traumatized children are so overstimulated they cannot achieve a state of secure readiness that is even necessary to learn. Levels of toxic stress in children can result in overactivated stress response systems and an inability to put thoughts into words. In some cases, children will react to stressors and triggers in the classroom even if as if the past trauma was occurring right in that moment. Their brains are now conditioned to employ survival strategies. Stress hormones flood the brain, and even mild stress stimuli. Even a great example that I can give you for that right now is I have a student who I know is experiencing significant amount of trauma in the past, in the present, and every afternoon when he goes home. And when he comes in the morning, hugs me, tells me he loves me, goes and sits down for breakfast, I ask him to put his chair in, and he'll push his chair back and be automatically upset. So even the simplest of directives for a child who's experiencing significant amounts of toxic stress can result in much more of an ongoing issue than one would think. For students in school, this can look like increased aggression to teachers, peers, or themselves, inability to regulate emotions, increased anxiety, and also being withdrawn or avoidant. It's not just outward, it's also inward. And the inability to build relationships and trust, as well as disrupted memory and comprehension. So the need to take action and to create trauma-informed schools for students who've experienced trauma is incredibly urgent. We know that from research that a traumatic event does not have to cause lasting chronic effects that have been discussed. Positive social environments, as well as caring relationships with even one adult, can lessen the impact of a traumatic event that can have in a child. Children who have the availability of a caring adult, community supports, routine, and stability are able to experience, and with even help, manage an event that can otherwise be detrimental. Early intervention gives the children the best possible chance to follow a developmental trajectory that is unencumbered by trauma. Developing and maintaining schools that respond and create trauma can become powerful tools in breaking that cycle. Schools and communities can foster welcoming environments where staff understands trauma's impact on relationships, behavior, and learning. In this environment, school-wide trauma-sensitive approaches would be woven throughout the school day, throughout the school staff, and individual supports related to social development would be trauma-sensitive. And so in the interim, outside of the school that I work at, I've been working with a nonprofit called Educators for Excellence, which takes groups of teachers and encourages them to act with policy recommendations in issues that they feel are greatly affecting their classroom. And so very recently, I've been on a team of 7 other educators working on creating policy recommendations for schools, for Boston, for Massachusetts, in terms of supporting students in creating schools that are designed to heal and address trauma. So at Educators for Excellence, we've tried to put together a very comprehensive, yet aggressive, yet manageable idea of what actions can be taken, both small and large. In your resources, you'll find the link to that policy paper, which we just released last week. So I'm just going to go into discussing some of those recommendations. Beginning at the educator level, we must first work, and it's sort of been mentioned throughout the course of today, but deepening practitioner competencies. In a survey of teachers across the district, 70% said they lacked training. Given the importance and complexity of trauma-informed practices, we highly recommend that the district prioritize training of school-based staff in trauma-informed instruction and develop standards on trauma-informed competencies. So not just training teachers, but then also developing standards by which classrooms can be, not judged, because that's a very strong word, but that can be assessed on. As a teacher myself, I know that I learn best when I'm working with other teachers and observing other teachers. And so one of our recommendations is, in addition to that, creating a professional learning network that will equally benefit schools, both public, charter, parochial, et cetera, where teachers can come together and learn and train and also discuss the things that are happening in their classroom. Educators would have the opportunity to share their practices and form connections with colleagues at other schools. One of the things that we've spoken about at my school, which, we've tried to make strides in terms of being trauma sensitive to our very under-resourced population of students, is, a lot of teachers also need the mental and emotional support in terms of working with students who've experienced trauma. So while building competencies is incredibly valuable and important, it's also incredibly important to develop these networks between teachers, where teachers can speak to each other, other staff members can speak to each other to lift that burden that can come from working with a very high population. As a result, this cross-district partnership will promote a culture of learning around trauma-informed practices across the district. In addition, there are often incidences where disproportionate disciplinary action can be taken against students who've experienced trauma based on their outward behaviors. And excessive discipline can happen to students due to the behaviors that manifest and can also be derived from cultural or linguistic misunderstanding between students and staff. Schools need to intervene in these and address implicit bias with staff to deepen cultural understandings and reduce disciplinary actions, creating more safe and welcoming environments for students. And then looking at district level recommendations, so these are recommendations that are just specifically towards Boston Public Schools. But it's important that schools look to implement trauma-informed practice and training, but we must also cultivate that community at large. It's a thread that's been woven through most of this day is it's not just about schools, it's not just about health providers, it's about the community at large. And due to that, with Boston Public Schools, as well as with charter and private, setting district-wide visions of what trauma-informed communities can actually look like. And part of that is really developing a shared language. Part of me going through all of the pieces of trauma, which is not necessarily new information, is starting to address that common language. Having educators across the state know what an ACE is, and being able to discuss trauma across disciplines, and be able to share a language so that community organizations and schools and mental health professionals and physicians are able to work together in those kinds of aspects. Boston cannot actualize a vision for trauma-informed schools and communities without engaging families and building upon existing partnerships. In order to have trauma-informed practices, they must extend beyond the school walls. And so we recommend that families and community mentors also are learning how to help and support students who've experienced trauma. And then lastly, in terms of thinking about reinforcing schools with resources, at the state level, we recommend that Massachusetts Department of Early Ed and Secondary Ed create partnerships with programs, on one hand, to start to bring in trauma-informed education and classes to a new class of teachers who are currently in graduate programs, so that it becomes much more part of the training of new teachers in terms of, and also adding trauma-informed courses, webinars, et cetera, to teachers who are also seeking recertification, who have already gone through their graduate programs. And then in addition to that, really looking at the state level, it was mentioned this morning about the lack of student psychologists, or the lack of school psychologists for students. And currently, Boston Public Schools employs 55 full-time school psychologists for 54,000 students, which is a ratio of 1 to 981. The National Association for Psychologists suggests 1 to 700. And I can also mention that at the school that I work at currently, it's 1 to 250, and it still isn't enough. We still are partnering with outside organizations such as South Bay Mental Health, Horizons for Homeless Children, and continuing to get those kinds of school psychologists and that kind of play therapy work with our youngest students. Because even one for a smaller amount, not even 700, is not necessarily even enough in terms of supporting students with trauma. And so the last thing that I will really leave you with is I often get asked, why right now? Why is trauma something that schools should be looking at, that policymakers should be looking at? Why is that sort of the buzzword at the moment? And I think my answer really is along the lines of researchers have been looking at adverse childhood experiences since studies in 1998 and earlier. Health surveys nationally and in Massachusetts constantly reaffirm that there's a very strong percentage of children who are experiencing trauma. And the data keeps reaffirming what we already know. But most importantly, there are students in classrooms right now who are suffering. They are either acting out, facing suspensions or mistrust, or withdrawing, silently fading down into the background, losing themselves. In addition, schools also continue to look at the widening achievement gap and success for each and every student based on equity and policies and procedures. While we look at rigorous academics, which is constantly a conversation of what are we not teaching, what are we not doing enough of, there needs to be a continued conversation and a spotlight on mental health and social emotional competencies for our children at every age. And even if we expect students to learn, we must first make sure that we're treating the part of them, of their minds and bodies, that will allow them to do that. In my experience, in my 9 years of teaching in urban ed and the 4 years prior to that where I volunteered in early ed centers in Roxbury and Dorchester, taking strides in policies and interventions and support services and training and in community is the strongest way to begin to heal students and families of the trauma that continues to impact their lives and is right now, I feel, one of the greatest struggles and threats to student achievement. Thank you.
Thank you. And so we're going to have Dr. Azzi-Lessing.
Super prepared.
Good afternoon, everybody. Good afternoon. So I'm going to try to weave together a number of themes that were presented today without doing too much overlapping, if that's at all possible. But I really want to focus on two P words. The first one being poverty and the second one being parents. My focus is on working with young children and families who are in poverty. And the way that I came to be an advocate and an acolyte of early childhood is many years ago, and I'm not going to tell you how many years ago, looking at all the young faces in this room. I was an administrator in a mental health center, in a community mental health center. And part of my job was to develop an alternative school for youth whose behaviors were so challenging they couldn't be maintained in even special classrooms in the regular public schools. And so, not surprisingly, most of the youth who were referred to our program were males. They were almost all poor. And they were largely of color. And that shouldn't surprise anybody given the many, several speakers who spoke about those linkages in terms of overrepresentation of people of color among those who are poor in our country, and also overrepresentation of boys of color in terms of schools deciding that these are dangerous kids who can't be worked with, and so forth. And the program was very challenging, and much to my chagrin today, it has expanded pretty dramatically. And I say chagrin and disappointment because that means, again, we are passing so many kids on and labeling them and considering them troublemakers and putting them in special schools when things begin in early childhood, and we don't do enough there. And for many families, we don't do anything there. What turned my head around is that when the case records would come in on each of these troubled and troubling adolescents, I began to notice that almost all of them had a case record from when they were very young, 2 years old, 3 years old, 4 years old, entering Head Start. And typical story was a young mom with a couple of little kids. She herself had had a traumatic history, was trying to raise children with very few supports, reached out for help, or someone tried to get the family help, and nothing really came of it because there weren't many programs and services that could really meet the needs of these families or were willing to go the extra mile that such families often need. And so that changed the trajectory of my career, but also my thinking about where we ought to be putting most of our resources. Dr. Rappaport was talking about the school to prison pipeline. Dr. Birmingham was talking about the preschool to prison pipeline. I focus on the prenatal to prison pipeline. We know which families are in trouble. We know which young parents are overwhelmed, and yet we continue to persist in doing either nothing or in creating a plethora of unconnected programs that are fragmented and don't really make enough of a difference, as Dr. Lasso had pointed out. So young children, more likely than any other age group in this country, are likely to be poor. Actually, 46% of children under the age of 6 are either low income, which is twice the federal poverty rate, or poor. And the poverty line, the federal poverty rate is around $16,000 a year for a parent and a child. Obviously, poverty has a lot of negative effects on children and their development. And many have spoken of that already. Do I have the wrong mouse, or am I doing the wrong thing with it? Use the keyboard. Okay. Why should we be so concerned? Poverty in early life represents a perfect storm of risk factors. Others have spoken about how brain development is rapidly occurring in early life. Common sense tells us the bodies and brains are most vulnerable and fragile in early life. Babies and young children are far more likely to be abused and neglected and placed into foster care than children in any other age group. And obviously, they are also more vulnerable to environmental hazards, poor nutrition, and impaired caregiving, including social determinants of asthma and other kinds of chronic illnesses. And that's about as far as I will go speaking medically to a room full of medical people. I know my limitations. I think the child welfare piece of the puzzle deserves some attention. In that, as I said, young children are far more likely to be maltreated and end up in the system. And as Dr. Rappaport, I think, said earlier this morning, most of the families that are in the system, most of the children that come into the system, come because of neglect, not physical abuse. And neglect is closely related to poverty. A lot of times it's a young child is removed because the family's living in a car or don't have a permanent address. Or a child is left with inappropriate caretakers because the parent can't afford adequate child care. And so instead of reaching out and helping those families in a substantial and meaningful way, we too often place children in the foster care system. Children in extreme poverty, those living at half the poverty line, are 22 times more likely to be maltreated than children who are not in extreme poverty. Not 2 times, not 4 times, not 6 times more, 22 times more likely to be maltreated. And typically it is neglect due to poverty. Dr. Rappaport also mentioned children on psychotropic drugs, and we have an enormous problem with the 800,000 or so children who are in the child welfare system nationally and the overprescription of psychotropic drugs. Children, including young children, are moved far too many times from foster home to foster home. Sometimes children, even here in Massachusetts, I can attest, have been put into facilities as young as 1, 2 years old because the state ran out of places to put them. And all of this moving around, all of these broken attachments, all of these traumas result in children who have behavior problems, surprise, surprise. And instead of, again, putting in the resources that it would take to help overcome trauma, and I think Nina did a very good job talking about the different kinds of effects of trauma, what we too often do is medicate because it's simple and easy to do. And I have seen a number of situations, including in Massachusetts, where children as young as 2, 3, 4, 5 years of age are on not only 1, but 2 or 3 psychotropic medications, drugs that have not been tested, obviously, on children that age, and where nobody knows what exactly they do to a young developing brain. And so we have children who are the least likely, poor children are the least likely to benefit from existing programs. Those are the children experiencing toxic stress that's also complicated by child maltreatment, maternal depression, parental substance abuse, and interpersonal violence. And again, this is another part of what I call the perfect storm, in that it is not at all unusual to find 2 or 3 of these factors co-occurring in a given family, in a given child's life. And the programs that we have tend to be, as Dr. Lesseau said, tend to be very single-focused programs. And they also tend to focus on the child rather than the parent. And when there is focus on the parent, the focus on the parent is as a caregiver, as somebody who can help the child develop, help the child be engaged in more early literacy interaction, or can help child-proof the house to keep the child safer, or can learn better ways to nurture the child and so forth from an intervention. And what we're not paying enough attention to is that poor children are parented by poor parents, and that most of the families that are in chronic poverty in our country these days are being headed by a parent or parents who themselves grew up in poverty, who themselves probably experienced trauma, who were not well nurtured. And many of them have come out of the foster care system. They went in as young children. They were moved around. They developed behavior problems. They were often medicated. And then they come out at 18, 19, 20 years old and become parents, because what else is available to them in many cases? Strategies for closing the readiness gap. What we really need, and you know, I think we need so much advocacy on this end, is what I call extra strength programs. Comprehensive, customizable, 2-generation interventions that are relationship-based and long-lasting. I have colleagues who like to say programs don't change people's lives, relationships do. And I think we all know that at some level that's really, really true. And yet we offer a 6-month program. We offer a 2-month program. We have a nurse come out once a month. And you know, we expect all of these dramatic outcomes, as others have pointed out, when we're doing so little in the face of a problem that has so many facets. We need to focus on all aspects of early child development. We now know that social, emotional, and cognitive development are all so intertwined that you can't be working on one without touching the other, or neglecting one without neglecting the others. We have to do so much more to promote strong parent engagement, which means delivering services in a respectful way. It means delivering the kind of services that people want and need rather than the ones that we're funded to deliver. And it means placing as much or even more focus on parents' mental health, education, employment, and other needs. An impaired parent is a hazard to a child. A healthy parent, a parent with supports, a parent who is able to move forward with their own goals in terms of their educational goals, their employment goals, their mental health goals, and improve mental health is an incredible resource to a child. And no program can really replace that. And lastly, why can't I get this? There we go. And lastly, we need policy reforms that enable the provision of the kind of services that I'm talking about. And this is big stuff, but we really need to look at doing things differently, funding-wise, and the way things are set up and structured, both at the federal and the state level. That means collapsing funding silos. This is education, this is public health, this is DCF, this is mental health, and expertise at both the state and federal levels. I was once telling a friend, and I know I have to wrap up here, but I was once telling a friend about how hard it is for families to get services. Mom has to go over here to work on her GED, but she's got to go way over there to get mental health services for her, but they don't provide mental health services for her 2-year-old, so she has to go somewhere else for that. And then early intervention for the 1-year-old comes from somewhere else. And my friend sat there a moment and said, gee, that's like giving a family a car one part at a time. And when you think about that, you know, how many of us, if we got the tailpipe one day, the muffler next week, the tires another day, how many of us would be driving around? I think it's an apt analogy. We really need to do more systems reform, systems building. There's a lot going on at the federal and state level in that area, but we need to do it faster, and we really have to focus on 2-generation approaches. And we also need new ways to think about, gather, and interpret evidence. We really fetishize, and when I say we, I mean higher ed, government, and the foundation world fetishize evidence that is gathered from randomized controlled trials. And while, you know, I understand and appreciate that works very well in medicine, one size does not fit all in terms of intervening with families from different cultural backgrounds, different locations, different needs, wants, and goals. And so the customized services and the comprehensive services that I'm talking about are not easily evaluated through heavily scientific methods like randomized controlled trials, but can be well evaluated. I'm certainly not calling for an end to accountability, but we have to think in new ways, both about how we deliver services and how we evaluate services. Thanks very much.
So I just want to quickly say that I want to bring us back to the theme that was introduced, I believe, by Dr. Birmingham and others earlier in the day, that there's hope. I think, you know, one of the things that was said is, as a society, if we don't face issues like racism, like bias, poverty, access, the disparities that we've heard about, and certainly mental health, in early childhood and in a 2-generational system, we're not going to be able to change things for the future. And we've certainly seen that there are lots of programs, lots of things out there that aren't working, lots of things, money that is being spent and policy and programs, but not in the most efficient ways. And there's no easy answers, I think we've heard. But from Dr. Dorsey, who is looking at in Boston, out of the mayor's office, looking at pushing the universal pre-K in Boston and thinking about access both inside and outside schools, and particularly the Boston Basics campaign. I don't know how many of you can remember those 5 Boston Basics, but look for that campaign. It's very active. Dr. Rose, who is with BPS, talked about facing the disproportionality in access, and also culturally and linguistically competent practice and norms that we should be looking at. Meema Luisi talked about trauma-informed practice and that impact that trauma can have for young children in ways that we don't often comprehend. although I know many of you in this field do, and how that can look differently, both withdrawal and aggression, and and not enable children to access learning. And also, lastly, we just heard from Dr. Azzi-Lessing about her focus on both poverty and the cycle of poverty, the 2 and 3 generational cycle, and also the need to focus on that other P, parents/families. So I want to open this up to questions for all 4, and there are microphones, I think, still in the room. Yeah, and so let's begin.
Given the topic that you were dealing with, I'd like to hear from you. Given the current administration, and obviously the philosophy is smaller government, and actually the assault that the Department of Education is under, what is going to be actually the outcome if actually the policies they are trying to implement actually go through, which is really a much smaller budget? I think this is a real thing because I'm also on a National Advisory Committee to the Secretary of Health. We just had a meeting, and we laid out a lot of these same very issues because we also want education, and health to work together very strongly. And Secretary Price is all in agreement. But the meeting ends with, but we'll do it with a smaller budget. So, when he leaves the room, what kind of discussion that we had? Well, it was just a very somber one, as you can imagine. But this is a very real issue because the United States of America, this is a capitalist society. We're an $18 trillion economy, right? We're the largest economy on the planet. So this is not a question about money. This is really a question about, it's not just political will anymore, but I think it's a philosophical one. Because if you take a look at the wealth, which allows families to make decisions, an average white family in America is $110,000 average wealth. That's what they have on average. What does an African-American family have? $5,000. A nickel for every dollar. How do you make a change when you don't even have the capacity, the flexibility, the resilience economically to do what needs to be done? Knowing that, do you have any suggestions or anything to help us? As all of us are very interested in obviously wanting to do the right thing on behalf of our communities.
Thanks for the question. I was about to scoot over and say, yes, Colin, what are we going to do about that, brother? So a couple of things. Certainly we see some looming threats on the horizon around the size of the budget, but I would also say that there are huge threats around ideas around portability in federal policy, because portability means that we've made a decision, if that's the overarching frame for how we're going to invest, that we're not necessarily investing in quality, we're investing in giving people resources to go find it on their own. And there has to be an investment in some universality of quality and access. If you were just giving people a set of tools who have disproportionate opportunity costs, disproportionate access, where they have to navigate a field of inequities, I think we're just going to actually start to deepen some of the disproportionality that we see just by giving folks resources who face disproportionate barriers. So there are a lot of fights that we have to continue to fight. I think in the early learning field, certainly Title I dollars and some other things are under threat, but states and localities have kind of gone it alone on a lot of early learning investments. And so I think we're going to have to redouble our efforts to figure out how do we double down and not to belittle the state in any way, because the state has been a great partner on a number of things, but to the degree, and I heard someone else say this recently, that Massachusetts may not be on the map from an early learning standpoint if it wasn't for Boston. So Boston has made some decisions on its own out of municipal dollars to figure out how we're going to invest in children. Now, Boston does not have taxable authority outside of the state. So part of what we have to figure out is how are we going to tap additional revenue with those kinds of constraints. The current proposal that we have going up to Beacon Hill around universal pre-K is actually to tap our convention center fund in Boston. So our convention center in the Seaport generates about a $90 million surplus every year. There are 2 line items in that surplus, sightseeing and car rental, that are generated exclusively in Boston. Our proposal is let Boston tap the money that Boston generates for that if we can't do anything through taxation. Now, we're going to have to fight some fights with our neighbors and other folks around the state who, for both real and perceived reasons, say Boston gets everything. But that said, I think part of the case that we have to make is that we're a great laboratory for the work that needs to be happening statewide. There are ways for us to generate resources in collaboration with each other. So, the mayor has been clear here that he's going to figure out how to get it done. In terms of what it means for the state, in terms of what it means for the nation, I think there's going to have to be some coalition of localized leadership really to figure out a set of counter strategies and what some of the offensive play is going to have to be around revenue raising and how we make investments. There's going to have to be a big public-private appeal as well. In our universal pre-K proposal, there are things that make sense for private dollars, catalytic investments and one-time buys, if we're trying to make sure that every program has a formal curriculum. It's a good use for private dollars. If we want to make sure that there are professional coaching and professional development resources available, good use. Things that are ongoing kind of systems implementation sorts of things, not necessarily a good use for philanthropic and private dollars. So we're going to have to figure those sorts of things out, but we've got a commitment and we're going to have to play some offense. I know that oftentimes we feel like we're at the whim of the federal government and it's all defense, but we're going to have to play some offense.
I would just add to that from a more global point of view that, we really need to use what we already have better. And, that's where I think we need to think about collapsing the silos, uniting funding streams, just doing a better job with that. But that's doing a better job with a shortage. There is not enough. And, I tell my students, pay attention, in your practice as a social worker, of all the times you're going to say, if only we had the money, if only we had the funding, if only, if only, if only. And I think that those of us on the front lines of this work really need to push past that question or push past that state of affairs and demand the money. And I know that sounds, kind of outrageous and pie in the sky, especially, in the current climate. But I also think it's important to demonstrate to policymakers and taxpayers that, even the best, most well-funded early childhood program is a heck of a lot cheaper than the lifelong expense of someone who starts, with needing special education costs, juvenile justice costs, and, so on and so on.
Good afternoon. I'm Philip Murray. I'm an adult and child psychiatrist, and I'm also a current fellow at the Harvard School of Public Health. My question is, so as we've gone through this presentation, we've talked a lot about the statistics, the studies, and a lot of the data behind this. And I'm just wondering, as you all have kind of pursued these things, what are some of the narratives that you use to connect as far as building those coalitions and raising money? Because we've talked about how you need to make sure things are accessible, communicating clearly, whether it's at a 6th grade or 4th grade level. And on one hand, these are complicated issues that are a combination of a number of things, but also you're dealing with people who view them philosophically from a different perspective. So just wanted to see what narratives have worked and what are narratives that we can use to push this forward.
You want to take that?
Sure. So from an educator's perspective, my narrative is typically in direct consultation one-on-one with families. And so the perspective that I can offer in terms of what narrative works the best for me is really that sort of team approach. Whereas, talking a lot about community and, in thinking about the current climate and things like that, the narrative of community, I think, is a very strong one. Particularly around children, and what I would lean most on is that everyone wants the best for their children. And the best for one child is ergo the best for another. Like in the smallest of terms, in a classroom of 20 children, if I can get the services for the kids who need it, and if I can open that narrative to families who may not necessarily understand the needs of others, then it's easier for me to do it in that regard, as a way to open that understanding and start to address the concern that ends up happening within classrooms. You know, oftentimes I have parents who, you know, oh, I hear this kid's name a lot, what's going on? And a lot of what I say to them is along the lines of, you know, everybody needs something different. And supporting this student also means supporting your student.
From my perspective, I think we have to accept that there is a good segment of the population in this country that will always fight helping the people who are most vulnerable. And, you know, it's where we hear throwing money at problems and, you know, all of that stuff. We don't complain about throwing money at roads and throwing money at our military and so on. But I think, you know, for those of us on the other side of this, you know, who genuinely want to make a difference in kids' lives and want to change the trajectories of the lives of children who grow up, who come into the world vulnerable and disadvantaged, I think we have to let go of the narrative that interventions are going to be simple and cheap. And, you know, I rail at too many New York Times op-eds and Huffington Post op-eds. You know, here's a home visiting program that gives taxpayers back $10 for every dollar it spends. It's simple and cheap. Well, it's simple and it's cheap, and it's going to work for families that are already doing pretty well, but not for families that are really in trouble. And the same thing with universal pre-K. You know, that if we tout that as the solution and that we don't have to do anything else with families that are the most vulnerable, we don't have to do better engaging parents and dealing with some of the systemic issues and so forth, I think we continue to shoot ourselves in the foot, because then the other side can say, oh, look, they put all that money into that, and, you know, the results are modest at best.
Just a couple of things. Boston Basics, I think, has been a different case than some of our other early learning work. Part of it has been about convincing people that the brain science is very easy to understand. So it's a couple of simple messages where we have found that audiences that you think would know kind of say, hey, all right, I didn't know that about the skills gap at 2 years old and 80% of brain development happening in the first years of life. So one, making that easy to understand. Secondly, helping people understand that they can play a role. We aren't asking you to be a hero. There's nothing at a Hercules level about this, but play your position where you are. And there's something that you can do to help the shared effort. I think what's also resonant for people is we have what we need to do the work. Part of what we need is better coordination. We're not creating a new system. We're not creating a new program. This is really about the tools and the resource that we need to better network what we have. I think the more system-based early learning arguments, there's so many challenges nested inside of that I think we're still trying to figure out how to reconcile a set of powerful messages. Part of it is what you believe or don't believe about poor people and people of color. So, I mean, to be very real, it's the implicit and explicit bias in the conversation. Secondly, I think it's also trying to think about, well, you know, if we're saying quality is about a well-prepared, well-compensated teacher, it's about compensation equalization. It's about what training looks like from your grad school all the way through professional development, your career. There are a lot of nested issues in there that quickly feel very big and maybe too big for a lot of decision makers. And I think in a setting where we're looking for the silver bullet oftentimes, to tell people this is not a silver bullet issue, but this is about kind of steadily doing, trying, discontinuing the things that we know don't work, pull the money out, and do more of the things that do work. I think it's hard in a political context oftentimes. And I think Noni said it right. When you've got 2-year, 3-year, 4-year funding windows, election cycles, those are very catalytic cycles, and there's a reset button that gets hit on the conversation almost every time.
And I'll just add, I think quite often we're talking about people who exist, and we don't build the agency of those people to talk for themselves and let us know what they need. And getting people that have resources or empowered to listen to them is difficult without mobilizing and getting critical consciousness of the people that we're talking about, right? So that's part of the philosophy around trying to get that critical consciousness into our students in high school, so when they come out the other side, they understand the statistics that you just dropped around wealth in America, and the fact that 98% of the Black community's money goes outside of the Black. So these are things that our students don't walk into society understanding. I say all the time, basically what I'm doing is trying to mitigate poverty and racism, right? And so how are we also getting into that kind of the global stream of equity and empowering those that this is happening to?
And I mentioned this before, but we're looking at trauma, and there's going to be a series that already started about trauma and PTSD and generational trauma in Milwaukee. And a nonprofit run by doctors, we want to help. We want to help, and we've got 3,000 members. And we talked about this. How do we address trauma? And I guess we understand, basically, the government, the way we look at it is that the government is not going to, that we're just not in a climate that they're going to spend more money, but they're going to cut programs. And basically, do we start over and help the government create a new program that would deal with trauma? Or is there a shovel-ready, which I'm going to use as a sort of analogy, program now that our organization can help and grow and scale up? And if there's a Boston program that deals with this, we can certainly start it in Wisconsin, because we're eager to do this. I think it's ripe for change, actually, this topic. Thanks.
Well, I remember your question earlier as well was talking about school psychologists and sending a lot of those kids in referrals. And I think when I think about trauma and early ed, a lot of it's about early intervention. Oftentimes I have my students come in when they're 4. And in some cases, it's great because they have a sibling at the school and I already know a lot of their history. And I already have a connection with their family because I knew they were coming, so I made an effort to do that. But in some cases, I have students coming in who I don't know a lot about and are starting from scratch. And I think, for me, I'm wondering where the early intervention was. In some cases, it's speech and language, and they're coming in, and I am unable to understand what they're saying, and I'm wondering what happened with, if they're going to the doctor or if they are coming from a daycare facility or an early care provider prior to that, like just where was the misstep here, that you've never been in early intervention services. And so I feel that a lot of circumventing or a lot of treatment of trauma early on in terms of either getting students into or getting children into just early play-based learning is one of the greatest interventions in terms of experiencing trauma. So even finding early play-based programs in and around your community or in and around Wisconsin as a state is one of the places I would think about starting in terms of if you're referencing patients based on what their histories are. I don't know of a program that is easily able to lift out from one state and put into another state. Most of the programs I know about are also very school-based in terms of programs in San Diego or in Washington or in Oakland or in New Jersey. And a lot of it is, social emotional learning curricula and et cetera that's happening at a very early level. But in terms of early intervention, in my mind, one of the best healers is play. And joy and fun and relationships, and it all feels very lovey, but at the same time, it's one of the best healers of trauma. So finding organizations that can provide that for 2- and 3-year-olds and help them establish those kinds of connections is one of the first things that I think of, at least.
I would also add that there are some really promising things going on all over the country around incorporating trauma-informed understanding into the training of people who touch children's lives, whether they be teachers, social workers, doctors, nurses. And I think that's critically important because it shows up in all different places and in all kinds of ways. And I think the more prepared the workforce is, the better it bodes for children. The other is, I'm going to make a shameless pitch, particularly for the medical people in the room, to find a way to raise your voice in advocacy on behalf of vulnerable kids and families. Policymakers are used to hearing us social workers and teachers. They know what we're going to say before we say it. Having a diverse group of professionals, and particularly the kind of respect that doctors typically have, given the science of what you do, can play a really significant role in changing the equation.
I'll add one more thing. Is it was already mentioned earlier, but also thinking, we're treating the childhood trauma, but also treating the adult chronic stress and trauma. And so I feel like a lot of that is also knowing what are the services that are available within your communities and within your neighborhoods, where parents who have just lost a job, that you are knowing where to send them and where to make those kinds of referrals. The school that I work at has a relatively robust full-service program where we're partnering with a lot of organizations, particularly most recently with Rosie's Place, where they're coming to the school and they're meeting with families and they're meeting with parents and offering their services and explaining what these kinds of services can provide. So as much as it's treating the child, others have mentioned it is also treating the families. Because especially from an educator's perspective, I can be trauma-informed and do all the right things and say all the right things and form those relationships, but they're still leaving at the end of the day and going home. And then they're coming back the next day, and in some cases you're starting over every morning until they get to a cognitive level where other conversations can be happening. But at least from an early ed perspective, it's a constant daily cycle. So getting at that root family relationship.
So in the interest of time, we're going to stop here. I want to say thank you again to our moderator and to our panelists. Thank you for your time.